Thank you very much, and really hard to follow that session. Perhaps like a lot of you, I've been here since 9 o'clock this morning. I think it's been a really fantastic day, and that's been a really good session. So I hope that I can just give you a little bit more information. And thank you all for staying. I know a lot of people have said to me that they've had to leave for various reasons, but I like to think we're the ones with stamina, staying to the end. And also I was hoping that if I stayed to the end, I might be able to nick one of those yellow chairs.
No, I've got a lot of them.
So today we've heard a lot about prevention, about helping people to live independent lives, about overcoming barriers and stigma. I think it's been a really inspiring day. And so what I was planning to do was just to underpin the day really with some of the resources that you can take away, take back to your places of work and go and look at to try and take some of that work forward. So we've heard the kind of big picture stuff, the inspiring stuff, and this is the kind of practical tools that you can go away and use after today. So a bit about NICE, our new role, upcoming guidance, some things to support things that you already have to do. And that's how I portray NICE guidance to people. It's not something additional that you have to do on top of all the work that you already have to do, but it's guidance, information that can underpin that and help you deliver what you already know you have to deliver. I've spoken to quite a lot of people downstairs today, and it seems that a lot of people are using NICE guidance, referring to it, drawing it into their work. Hopefully you will all have heard of NICE, at least, if not in your work, perhaps on the front page of the newspapers, but hopefully in relation to the work that you're delivering. So NICE produces evidence-based guidance. We look at the evidence around topics and we make recommendations about what works, i.e. what's effective and what's cost effective. So if you want to know what's the effective intervention, the effective way to treat a particular condition, NICE guidance is one of your ports of call. But we also now develop quality standards, and I'll tell you a bit about those, and a range of information services. And NICE produces guidance now for health, public health and social care. From April 2013 we were given a new role to produce guidance for the social care sector. And I hope that for people working in areas like you where that interface between health and social care is so strong, that having one guidance provider that looks at the evidence and produces guidance across both health and social care in a more integrated way makes sense. It's certainly the way that our services are going. Perhaps a lot of you have seen that level of integration between mental health trusts and community providers, and so it makes sense to have one provider to produce that guidance. And often people have slight misconceptions about NICE guidance and think that NICE is sitting in a big office in London churning out guidance. And in fact what we do is we bring together clinicians and practitioners, people working in the field, and they produce the guidance, they make the recommendations. So NICE brings the evidence to those people like you who come together, about 18 people, 20 people come together as a committee, and we bring them the evidence, and then they make the decisions about what is this evidence telling us, what are the recommendations for practice. Everything we do is based on a comprehensive evidence base and has expert input. So as I say, it's not just NICE producing guidance, but people out there in the field. We have patient and carer involvement in everything we do, and those lay people come onto our committees and they really help us. They really change the way that the committees think sometimes, and support us to produce guidance that's really understandable and meaningful. We like to think that the advice we produce is independent, so once a committee starts producing guidance, they don't have any pressure put on them from industry or politicians. We try our best to produce independent guidance. And we consult on all of our guidance. It's reviewed every 3 years. And NICE has a very difficult job sometimes, looking at the evidence and making recommendations. And the only way that we can really do that is to be completely open and transparent about the evidence that we look at and the decisions that we make. So we always are open. If you desperately want to, you can read all of our process guides, all the evidence underpinning our decisions. So why would you want to go and look at NICE guidance? Well, as I've said, NICE guidance tells you what's effective and what's cost effective. So it tells you what works and what's good value for money. For you as clinicians and practitioners, it's really important that you deliver what works. And for your organisations, it's really important that you're delivering what's good value for money. NICE guidance, of course, helps to reduce variation, so everyone gets the same good quality care. It can help to drive improvement. Some of the people that I've spoken to today from provider organisations, independent organisations, small companies, NICE guidance can help you to demonstrate the quality of your service and use that in contracting, commissioning, in tenders, that kind of level of information, to be able to demonstrate that you're delivering good quality evidence-based services. And I'll show you a bit of information about the physical healthcare sequin for those of you working in NHS trusts. And of course, one of the things that people often say to me is NICE guidance helps with integration because it gives a common language for people working in all sorts of settings to come together. So mental health trusts coming together with local authorities commissioning services based on NICE guidance from social care providers, working together across health economies. There's a range of guidance that NICE has. I've just put a few up there on the left-hand side. But there's over 200 pieces of NICE guidance, over 300 drugs that we've looked at, so a really broad range of guidance. Do go and have a look at that. I think the way that NICE has developed, there's a lot there that can really support your services. So I've picked out some of the ones relating to mental health, but of course there's a lot relating to physical health care, some really basic things that we all have to do. And then I just wanted to flag up a couple of pieces of guidance in development. So NICE has surprisingly never produced any guidance specifically related to people with learning disabilities. But we've been asked to produce 2 as a follow-on from the Winterbourne review. Mental health problems in people with learning disabilities and challenging behaviour in people with learning disabilities. We're also working on some guidance for mental health of people in prisons. We heard some talk earlier about the transition between services, and we know that that's a really difficult area. So NICE has been asked to produce guidance on the transition between inpatient mental health services and community settings, and the transition between child and adult services. So it's just flagging up a few pieces of guidance there that might be relevant to your work that we have in development. If you go to the NICE website, this is the address, you can find all of this guidance. And we've redesigned our website a little bit so that you can find, on the top right there, you can see those hieroglyphics, which on our website do actually have a name underneath them, which hasn't come out on this screenshot. So we're not expecting you to know what those symbols mean. It does say them on our website: pathways, guidance, quality standards, and NICE evidence. And we've put our guidance into these filters. So if you just want to look for a particular condition, all of the guidance that we produce is together. If you're just looking for a particular setting, so with the workplace or care homes or schools, you can find that by looking at settings. If you're just looking for population groups, so just older adults, for example, you can find all of our guidance that way. So rather than sort of having to know what's there and searching for it, we've brought it all together in that way. One of the main things that I wanted to flag up to you was all the practical support and resources that are available from NICE. So often I find that people know about a piece of NICE guidance, but because there is so much on the NICE website, people tend to Google to find a guideline. Do you do that? And what that means is that people often miss all of those tools that are there because Google just takes you straight to the guideline. If you go through our website, you can find all of these tools and resources that come with the guidance. So if you're working here with this example with people with psychosis and schizophrenia, here's some tools that can help your practice, that can support and underpin that. They can help professional development, they can help team working, they can support care delivery. And also I just picked out some of the pieces of guidance that relate to the physical healthcare sequin. So we've heard about parity of esteem today of mental health services with physical health services. But I remember when I worked in mental health services, sitting in a room and people were talking about things like cholesterol and diabetes. And we said, well, that's not our work. We're a mental health trust. 10 years later, it's very different. We know that we have to think about care holistically, and we have to think about the physical health care of people coming to us with mental health issues. So NICE has produced quite a lot of guidance that can relate to that, and there's a lot of support tools there as well. I've given out earlier today some sheets with this information on. If anybody still wants one, I still have some you can pick up from me that give you the hyperlinks to all of these resources. So if you know that within your organisation you have issues around supporting people with diabetes or supporting people's blood pressure, here's some tools that you can go and use to help you improve that within the services that you deliver. We've put together some online learning modules which are free to use. Anyone can access them through our website. They take about an hour to complete and they give you a certificate. Some of them are registered for CPD points, but all of them will give you a certificate. So for continuing professional development, something that you can put in your portfolio. Again, if you want to know more about a particular area, if you feel it's a training need within your team or your organisation, or just for personal development, these are something that you can go and do quite easily and quickly and for free, which is always good. Has anybody used NICE quality standards? A couple of people I've spoken to already. These are something that NICE started producing about 18 months ago, and they're a bit different from our guidance. So our guidance tells you what to do, how to deliver care to the patient, to the service user sat in front of you. But NICE quality standards are evidence-based measures of quality. They're something that you can use to drive quality improvement. Clearly, when NICE produces guidance and other people produce guidance, we look at the evidence, and that is used to produce guidance from NICE and from a range of other providers. But NICE then goes on to take that guidance and make it into statements of good quality care. So if you're commissioning a service for dementia, what are the 6 things that would really indicate a good quality service? So there's something that commissioners can start to use rather than looking at how you deliver your service, looking at your outcomes. Are you achieving these outcomes? There's something that you locally can look at to think about, this represents the best quality service. How does this match what we're doing? Let's have a look at these 6 or 8 statements. And if there's 8 statements in there, okay, 5 or 6 of them we think we're doing okay. But actually there's 3 here where we know from national audit, from what service users are telling us, from what GPs are telling us, that there might be issues. Let's take those and use them as a piece of quality improvement. So they're measures, they're evidence-based, outcomes-focused measures that you can use to drive quality improvement. And for providers who are tendering for services, really useful to be able to demonstrate in your tenders, in your contracts, that you're in line with NICE quality standards and that you're using them to improve services. For services inspected by the Care Quality Commission, they won't expect you to be using and implementing all the quality standards, but they will want to know that you're improving quality, that you have a programme to drive quality improvement, and these are a tool that you can certainly use to do that. So I just wanted to explain what those are, because I know a lot of people are struggling with the difference between NICE guidance and NICE quality standards. A piece of feedback that I was getting quite regularly, and my team were getting quite regularly out in the field, was there's too much guidance. We can't find what we want. When we do find it, it's 400 pages. We can't read it all. And so what NICE has done is produce NICE pathways. This is a way of putting guidance into an algorithm format, so you don't have to read a whole 300-page document. You can just go to the part of the guideline that you're interested in. So if you're working with service users with a bipolar disorder, if you're just looking at children, you can just go that pathway. If you're just looking at adults, you can just use that pathway. If you just want diagnosis, just click on this node. If you just want treatment, click on this node. And where you click on the node, it will give you the recommendation, the evidence-based information on the right-hand side. So I would suggest to you that this is probably now one of the best ways to find evidence-based information about particular conditions. And it means you don't have to wade through a massive document. It's all there for you on, if not a click, several clicks through NICE pathways. This is how you access them from our website. And here, the resources that I've mentioned are also attached there to the pathway. And there's also the information there for the public. So we produce another version of our guidance that's in an easy read format, using language, simple language that members of the public will be able to understand. Great to print out and give to your service users or refer them to. It's also really great to read yourself. I quite often just read the information for the public section. And you can download them to your mobile or print them off. And for those of you more tech savvy, NICE also has an app, and we also produce the BNF app. They're both free to use, so it means that you have the NICE guidance and all of that medicines information available to you at all times. Also, it's updated regularly as well. So I remember walking around with a copy of the BNF that was 2 years old. Now this is updated every month. So you've got the latest the latest information available to you. And I've been talking to people downstairs today quite a bit about how to get involved with what NICE is doing. There's lots of ways to do that, and the best way is to register your organisation as a stakeholder with NICE, which you can do through the Get Involved section of our website. And NICE really values that stakeholder input. There have been times where we've produced a draft of a guideline and the stakeholder feedback has changed what we've recommended. Our stakeholders can comment on the scope of the guidance. They'll get notification when we're recruiting to the committee, when it's in a final draft format. And if you're a registered stakeholder, you're entitled to comment on all of that. So you're all working in areas where NICE is producing guidance, and we would really welcome your input. It also, of course, gives you a heads up in terms of what's coming. It enables you to say that your organisation is involved in NICE, and you're an organisation that's constantly thinking about the evidence, developing the evidence. And that's about all I had to say. This is my team. I'm part of the field team at NICE. There's 8 of us that cover England and Northern Ireland, and our role is to go out and about, talking to organisations. I visit every NHS trust in my patch and every local authority every year, but also a range of other organisations, private providers, community organisations. So if you would like to talk to anybody about NICE guidance, you have any questions, you want to follow up on any of those resources, do get in touch. So I hope that that's given you some really practical things to take away from today, and thank you so much for still being here.
Thank you.